cutting edge of pain management. A lot of the procedures that we do, other doctors do not do. Our research, Dr. Bond, if he's not in the OR, he is researching new procedures, better procedures, procedures that use less medication and get better results. Or Dr. Bond will come in from a different direction, put the medicine right on the areas, not putting the medicine in your back and hoping that it crawls around the spinal cord and gets to the back of the disc and stuff like that. I don't want to get too detailed in the procedures because it would take all day. But we do many procedures with 1/3 or 1/4 of the medication in more specific areas so we get better outcomes.
Our ultimate goal is to decrease the amount of narcotics that the patient has to take to function. Some of our more common therapeutic modalities include injections of the major joints, and that's your hips, knees, shoulders. We also do a lot of work in the back area, and that starts from the cervical, thoracic, and lumbar. And we do anything from facet injections to radiofrequency ablations, selective nerve root blocks. Those are some of our more common procedures done.
At BACAS, one of the things that we know for sure is that effective treatment starts with effective diagnosis. And so one of the things that we understand is that that there can be a cause or causes for a person's condition. And so we need to make sure that we make a detailed diagnosis and that we take careful and a concerned approach towards doing that. And so we start by doing a comprehensive medical history, and we do physical examination, and sometimes we order diagnostic testing and things like that. And that may not sound like that's an unusual process, but you'd be surprised how uncommon that is in pain management offices. But we feel like that's the heart of what we try to do. If we can diagnose a person more precisely, well, then we can treat them more accurately. And if we can treat them more accurately, then we're going to be more effective in what we do.
I think the multidisciplinary approach is important because it allows us to appreciate pain from different perspectives. It allows us to treat different populations of patients. And it keeps us aware of the impact that pain can have on different systems within the body. We enjoy that, I think, more than anything else from a personal standpoint. Because it keeps things new. There's an amazing similarity in terms of pain generators from one organ system to the next. And by allowing us to broaden our intellectual perspective, we can find links between different systems. Frequently, abdominal pain can be mediated by some of the same or very similar mediators as back pain. And so, we frequently will make discoveries or associations that typically were not classically affiliated.